Now, the government's announced £250 million of funding for NHS hospitals to increase capacity ahead of the winter.
Well, we're joined now by the Minister of State for Health and Secondary Care, Will Quince from Westminster. Good morning to you. £250 million might not sound like a huge amount when you think about the actual NHS budget, but where is this money coming from? It's not new money, presumably.
Yeah, it's £250 million. It's not new money, it's from the capital budget, and that's for 30 hospital trusts up and down the country. And this is actually part of a wider funding commitment earlier that had been made of £1 billion in revenue funding to improve urgent and emergency care and our resilience ahead of this winter. And what that £250 million will buy is an additional 900 beds for this winter.
Which is going to be of benefit to some people, but there's still the fundamental question of the whole structure of the NHS. And the problems we've seen in the past is not how many beds are in the hospital particularly, it's how quickly you get people out of the back end of the hospital and get the system flowing.
You're absolutely right. And actually those 900 additional beds are part of our wider £1 billion urgent and emergency care recovery plan, which is actually an additional 5,000 beds for this winter, alongside other plans, including 800 new ambulances and significant investment, as you rightly point out, in adult social care, because that patient flow through the hospital, so when patients are medically ready to be discharged, that we can get them out into an appropriate care setting or back home, frees up the capacity within urgent and emergency care, so our emergency departments, so they can then be moved up into the hospital, and that flow through the hospital continues, and that's very much part of this plan.
Of course, where you increase capacity, you then need to increase the capacity, presumably, of those caring for patients, the doctors and the nurses. And we know there's a huge problem with retention, not least because of this ongoing dispute over pay, particularly with the doctors.
You're absolutely right, and staffing is a key component of this plan. The additional staffing numbers will come from that £1 billion budget, so the additional revenue funding which will flow through NHS England through to those 30 trusts. We have, of course, over the past year seen an additional 6,000 doctors and 15,000 nurses, but each of those trusts that have committed to build those 900 additional beds within their trusts have assured us and NHS England that they will be able to staff them with the funding supplied.
It's an interesting situation for government, isn't it? Because people care about your department. Obviously they do. Health is really important to us. But part of the pressure on the NHS and pressure on the country as a whole is down to immigration, those high immigration numbers, illegal immigration, of which at the moment, whether it's the government's fault or not, it's just not able to get a handle on.
Well, these are complex issues, and if you're referring specifically to the small boats issue, progress is being made. We've got partnerships with the French, partnerships with Turkey, with Albania. I understand over 90% reduction in Albanians crossing the Channel. But this is a massive issue, something that both the Prime Minister and the Home Office are gripping. It is not an easy thing to fix, but the plan in terms of a deterrent is working. Our Illegal Migration Act, and those arrangements in place, we are seeing a reduction. Our arrangement with the French, down some 33,000 last year, 40%. But of course, you rightly point out there is a lot more to do.
Yes, but sorry, just talking about your arrangement with France, I mean, you have to look at the front of the Express. Dear France, for £480 million, can you actually stop the boats? We've had an intervention from the former Home Secretary, Priti Patel, saying we need to get tougher on the French. We've had 6 drownings just this weekend, closer to the French coast, and you're holding up our relationship with the French as some sort of success. And you talk about Albania, and we read this morning about a new smuggling route being introduced by the Albanians from Santander in northern Spain to Portsmouth using lorries. You know, this is like a whack-a-mole situation. You deal with one issue and you have another problem cropping up. You're not in control of this situation.
Well, it is a horrific scenario, and those tragic deaths in the Channel set out exactly why we do need to take the action we are against those people smugglers that are encouraging people to take this incredibly dangerous route. But that action is being taken with our new agreement with Turkey around tackling those gangs and people smugglers, and our arrangement with the French. And I understand the frustration. I know people want us to go further, but we have reduced the number of crossings by 40%, or 33,000, through our partnership with the French. French. And I think context is important too, because actually the crossings coming over into Europe, not over into the UK, but into Europe, are up 30%, yet the crossings from France over to the UK are down. I'm not saying that, that it is fixed. It isn't. We've got a lot of work to do, but the partnership with the French is working, and we've got to stick with it.
Do you think that we can make the difference that we want to make on these figures whilst we're still a member of the European Court of Human Rights?
Yeah, I think we can. And if you look at our Immigration Act, we are totally committed to our international treaty obligations. We believe we can achieve what we need to within the Illegal Immigration Act. But I think it's important to point out that opposition parties and Labour have tried to thwart our efforts to bring in that legislation at every available opportunity. So it is being made difficult by other parties within Westminster, but nevertheless, we are committed to doing this. The legislation is in place. Obviously, we've got the Supreme Court ruling, but we are committed to the Rwanda plan.
Except you are at odds then with members of your own party, and indeed, we're told, a third of the cabinet who want to take Britain out of the ECHR.
Well, I think we are committed to our international obligations under treaty, and we believe that the measures that are set out in the Illegal Immigration Act will enable us to achieve what we need to within the ECHR. So I understand that there are always going to be differences of opinion, different views. I understand how frustrated many of your viewers are about the crossings over the channel. They want action, and they want it now. That action is being taken. We understand the frustration, but I'd ask people to stick with us. The plan is working, deterrence is working, but we have got more to do.
And yet, even with things like the Bibi Stockholm, which, in the best-case scenario is a tiny sticking plaster on some of the problems we've got in terms of processing and housing people over here in the UK, yet even that has fallen absolutely flat on its face. And that begs so many questions, doesn't it, as to why something which you knew was going to have so much attention wasn't properly checked out.
Well, I don't accept that characterisation at all. And, the barge is only one part of a much wider plan, but nevertheless an important part. Now, of course, the safety of everyone within the United Kingdom, especially health, is of our utmost priority. That's why the action was taken to disembark from the barge. But as soon as it's safe to do so, we will be using the barge, and I hope that will be in the next few days.
OK, well, Quince, we'll leave it there. Minister of State for Health and Secretary Care, thank you very much indeed. Oh, you wanted to put another question?
I was just quickly going to ask, 65 years since the first Carry On film. What's your favourite Carry On, Minister?
Carry On Camping, I think, probably. I must admit, I haven't seen any for a long, long time. It was probably with my grandfather many, many, many years ago.
Yeah, no, it's an excellent choice. Minister Will Quince, good to see you. Thanks very much indeed.